Hey, Dental Bestie, welcome back to Pretty Smiles Academy. Today we are going over dental terminology basics for dental assistants. When you are new in the dental office, the words alone can make you feel lost. The doctor may say things like MOD composite, PA x ray, occlusal, distal, prophy, or set up for an extraction, and you're standing there wondering what everything means. So let's break down the basics in a simple way. First, let's talk about tooth surfaces. Every tooth has different surfaces, and you will hear these words all the time. Mesial means the side of the tooth closer to the middle of the mouth. Distal means the side of the tooth farther away from the middle. Buccal means the cheek side of the tooth. Lingual means the tongue side. Facial usually means the front side of anterior teeth facing the lips. Occlusal means the chewing surface of the back teeth. Incisal means the biting edge of the front teeth. So when the doctor says a filling is on the occlusal surface, they mean the chewing surface. When they say distal, they mean the side facing away from the center of the mouth. These words matter because they help you understand charting, treatment plans, fillings, x-rays, and what area the doctor is working on. Now let's talk about types of teeth. The front teeth are called anterior teeth. The back teeth are called posterior teeth. The front teeth are usually incisors and canines. The back teeth are premolars and molars. Incisors are used for cutting. Canines are the pointed teeth. Premolars and molars are used for chewing and grinding food. So if someone says posterior composite, that usually means a tooth-colored filling on a back tooth. Now let's go over common appointment terms. A prophy is a basic dental cleaning. A comprehensive exam is usually a full exam for a new patient or someone who has not been seen in a while. A limited exam is focused on one problem area, like tooth pain or swelling. A periodic exam is a routine exam for an existing patient. A recall appointment means the patient is coming back for their regular cleaning and exam. Once you understand these basic words, the dental office starts to feel a lot less confusing. Now let's talk about x-ray terms. A PA, also called a periapical x-ray, shows the full tooth from the crown down to the root area. A bite wing x-ray helps show cavities between the back teeth and bone levels. A panoramic x-ray, or pano, shows the whole mouth in one large image. You may also hear FMX, which means full mouth series. That is a full set of dental x-rays. As a dental assistant, you may help take x-rays, organize them, mount them, or make sure the doctor has the right images before treatment. Now let's talk about restorative terms. A composite is a tooth-colored filling. An amalgam is a silver-colored filling, although not every office uses it as much anymore. A crown is a covering that goes over the tooth when the tooth needs more protection or strength. A temporary crown is the temporary covering the patient wears while the final crown is being made. An impression is a mold or scan of the teeth. A buildup is when material is added to a tooth to help support a crown. If the doctor says crown prep, that means the tooth is being prepared for a crown. Now let's go over procedure terms. An extraction means removing a tooth. A simple extraction usually means the tooth can be removed without surgical sectioning. A surgical extraction may involve more steps, like removing bone or sectioning the tooth. A suture is a stitch. Hemostasis means controlling bleeding. Anesthetic is what numbs the patient. Topical is the gel placed before the injection to help numb the gum tissue. You may also hear different specialist names. An orthodontist handles braces and tooth movement. An endodontist handles root canals. A periodontist handles gum disease. An oral surgeon handles extractions, implants, and surgical procedures. A pediatric dentist treats children. Here is the truth. You do not have to memorize every dental word in one day. Keep a small notebook or notes app called Dental Words I Need to Learn. Every time you hear a word you do not understand, write it down. Then look it up later or ask someone during downtime. Dental terminology is not about sounding fancy. It is about understanding what is happening so you can assist better, communicate better, and feel more confident in the room. If this helped you, subscribe to Pretty Smiles Academy for more beginner friendly dental